Hello, my name is Brandy, and for today's NICU handling practicum, I will be discussing various feeding and handling positionings, beginning with transitioning from supine to prone, following with swaddling, then cheek support, pacing, all three options, bottle resistance, and concluding with elevated side lying. So I will be starting off with transitioning a baby from a supine to prone position. Okay, so for our first positioning from supine to prone, we want to make sure that us, the clinician, is relaxed, that we reviewed all monitors, that we have taken note of the environment, of the baby themselves, verify that there is less than 60 respirations per second, and that there is no agitated crying state. It is okay for the baby to be in a drowsy state. Now, we always want to make sure that we have placed our hands on top of a rolled blanket right on top of baby's trunk, gently putting some firm contact on the trunk of the baby to allow for the least alerting touch. We want to make sure that we keep note of keeping hands on baby the whole time. We want to begin with slowly bringing everything to midline for the most physiological flexion. So we want to gently hold from shoulder to arm to hands while bringing baby to midline with both hands. Now we can use a finger to give some flexion to the hip, bring the hip up, and then we want to make sure that we can use the other hand to bring the opposite foot up as well. So now we have everything nice and midline slowly. Okay, so we just want to verify that the baby is straddling the blanket to allow for flexion. We want to do as minimal sliding as possible. So now we want to focus on rolling the hand horizontally under the back and the lower neck. Now baby's on her side, and now we want to slowly switch hands to slowly rotate her hands to clear the airway once baby is prone. Now we want to make sure we're keeping a hand on her at all times. We want to turn her head slightly. We're going to use this as some padding for her to make sure that her shoulders are staying nice and rounded. We're keeping that hip flexion, knee flexion, and this rolled blanket helps with that. We want to make sure that we try and keep hands to mouth. And once the Snuggie is in place, which should already be prior to, then we can go ahead and begin strapping baby in to provide those boundaries and that containment. And we want to provide enough room by baby's legs to allow baby to flex or extend her legs as necessary. And there we have it. Okay, next we will be focusing on swaddling of the baby. So first we will spread out a blanket. A more even-sized square blanket would be preferred over a rectangular blanket, just to allow for equalized folding. However, this is what's going to work for today. So we're going to go ahead and spread out blanket and fold one corner down, which has already been done. Then we will place our baby's head above the fold. Okay. Next, we will wrap one side of the blanket over the baby's arms, with the body and arms nicely inside. Okay. Next, we will tuck that blanket underneath our baby, as so. Next, we will fold from the bottom up, tuck, and lastly, we will wrap from the other side and tuck. And there you have it, swaddled baby. Okay, so next I will be demonstrating cheek support. I'm going to be implementing cheek support during this baby's feeding because baby has demonstrated a high suck-swallow ratio. So first, I will begin with placing the baby in this position to allow for the most optimum feeding position for both the parent and the child. So I will be crossing my legs and allowing baby to lay comfortably on my thigh while laying them slightly sidelined, okay? Next, I will then place my ring finger on one side of the baby's cheek and my middle finger on the opposite side, keeping in mind to not go so far back so you're not too close to the masseter, and then gently push while baby sucks, okay, as so. Now gently hold this position and be sure to not squish the lips and pop the seal by making sure that you keep your fingers away from the corners of the mouth. Now the purpose of this is usually a term baby will have bigger cheeks to help with sucking, but with the pretermed infant, they have less cheeks to work with, equating to a bigger oral cavity and a more difficulty taking in flow. So we assist with decreasing size to increase oral pressure and increase that flow and that bolus and flow rate. Now we want to make sure that we're facilitating that flow better for them for a more successful feeding. Next, we will be discussing pacing all three options, beginning from the least invasive to the most invasive. So first we will start off with bottle tip, following with bottle roll, finishing with bottle removal. Now these three types of external pacing's goals is to get the baby from an abnormal prolonged sucking pattern, also known as feeding induced apnea, to an immature sucking pattern, okay? Okay, so for bottle tip, we are gonna go, the goal is to slightly tip the bottle down during the feeding. So the goal is to get the milk out of the nipple. The baby will realize that eventually there is no milk coming out, but still stays latched, and this allows the baby to begin breathing. It is the least disruptive and the least disorganized external pacing method to use. So again, bottle tip down. Next, we will demonstrate the bottle roll. The goal of this pacing technique is to roll the tip of the nipple off the center of the tongue while still keeping the nipple tip on the sides of the tongue. This will trigger the baby to stop sucking by removing the nipple off the trigger point, the middle of the tongue. But the goal is to not remove the bottle nipple from the mouth completely, just enough to get them to pause, breathe, and then roll the tip back onto the middle of their tongue to trigger that sucking sensation once again and continue feeding. Lastly, bottle removal. The goal is to remove the bottle tip all the way out of the mouth and to jumpstart the sucking reflex again. With this technique, you must root them again to get them to kickstart the reflex to root, so either the sides of cheeks or the sides of the lips, and allow the baby to latch once again. Allow that the tip of the bottle to touch the middle of their tongue and allow that reflex to begin resucking once again. We want to make sure that we are keep monitoring that every 3 to 5 sucks. We continue throughout the entire feeding and continue this whatever method you intend on using, which will force the baby to pause between bursts, prevent apnea, and force the baby into an immature sucking pattern. The next technique that we will be discussing is bottle resistance. Now this is a technique that's used if a baby has a weak suck. The baby will still be completely latched to the nipple as so during the feeding. Now the goal is to slightly pull the nipple, but not completely out of the oral cavity or from the lips. The baby will create a stronger suck by creating this gentle pull, and this will be completed during nutritive sucking. And an example of this would be if we were to be sucking hard through a straw for a milkshake. It would provide them that strength and that grip to suck a little bit stronger than they normally would. Now, the final position that we will be discussing is elevated side lying. Okay, now this involves laying the baby in your lap or on a cushion as such, on their side. And you can also lift them slightly so they are not lying flat on their side, but instead in an inclined position. This is a more natural way for babies to feed because it supports breathing and swallow coordination. Now, this also allows the baby to support itself on the cushion, so you're not having to do any work necessarily. It's a more relaxed feed for both you and for the baby. So we want to make sure that the ear is facing towards the ceiling, the other ear is facing towards the floor. Make sure you keep their head higher than their hips. Support your baby's back and head with one hand as you offer them the bottle with the other hand. You can prop your foot on a footrest or stool or a bed to make this position easier to do so. Now, if the flow of milk is too fast, which can often be the case in the very beginning, if your baby has yet to master their suck, swallow, and breathe coordination, then this position will allow the milk to safely dribble out of your baby's mouth instead of coughing while feeding. You are able to clearly see your baby's face and watch for signs that she or he may need a pause to take a breath. And this is also a great position for babies who have reflux or are prone to vomiting. If you place the baby on its left side to feed, it also increases the space from the bottom of its stomach to the esophagus to make it less likely for them to vomit or reflux. Thank you, and that concludes my NICU practicum handling presentation.